Ask the Scoliosis Chiropractor. Scoliosis is a highly prevalent spinal condition that affects all ages, and it's most commonly associated in children, even though the largest group or population of patients is the elderly. Scoliosis is the leading spinal deformity amongst all school-age children, and while there is never any treatment guarantees when it comes to treating or trying to reduce scoliosis, we do know early detection associated with early intervention is definitely associated with treatment success. So let's answer some common questions that I'm asked as when I treat scoliosis as a chiropractor. Now, one common question I get asked is, if I have scoliosis, does that mean my child will get it as well? Now, we know scoliosis isn't 100% a genetic condition, meaning it's not caused by bad genetics or a single gene or a simple genetic mutation. None of this has been identified to account for scoliosis development. They've done studies on identical twins, and they've actually only found about 60% of identical twins to both share scoliosis, where 40% don't. So therefore, genetics alone can't be the cause, because if that was the case, all identical twins will both share scoliosis. We know scoliosis has a familiar tendency that if somebody in the family has scoliosis, that there is a risk factor for somebody else in the family to have scoliosis, but it doesn't necessarily mean it's guaranteed. So just because you have scoliosis, we don't know if your child will develop it as a result of it. And approximately 80% of all scoliosis cases are idiopathic, like I mentioned, and idiopathic means we don't know what causes it. It is an unknown reason. Now, there are 20% of scoliosis that are associated with causes like congenital causes or neuromuscular causes or traumatic or degenerative causes, but 80% are completely idiopathic. We don't know why. A lot of questions I get asked is, what is a Cobb angle? And a Cobb angle is really the standard of measurement when we measure the size of scoliosis. And the gold standard of taking the Cobb angle is done on a scoliosis x-ray. It's by far the most accurate way and the simplest way of measuring a scoliosis. And it's measured by drawing lines from the most tilted vertebra on the top to the most tilted vertebra on the bottom of the curve and comparing these two tilts in degrees, and the degrees determines the severity of the condition. The higher the degrees, the more severe the scoliosis is, where the smaller the number, the more mild the scoliosis is. The Cobb angle must be 10 degrees or greater to be considered a scoliosis, and the severity can range from mild, moderate to severe, and I like to use a fourth category called very severe scoliosis. Is scoliosis surgery inevitable? Meaning if you have scoliosis, no matter what you do, you're going to end up having scoliosis surgery. And there's two main approaches when it comes to treating scoliosis. I like to call them surgical approaches and non-surgical approaches. Now, traditional treatment options, meaning traditional treatment options managed by orthopedic surgeons, tends to funnel patients towards invasive surgery, meaning they have a reactive model. They normally wait for curves to worsen into the severe range before they consider any treatment options. They don't have any strategy for mild scoliosis and very limited strategies for moderate scoliosis. So therefore, there's not a lot of treatment options until curves become severe. And then at that stage, they recommend scoliosis surgery, where modern conservative treatment treats scoliosis at a much smaller size. Therefore, we can intervene way sooner to try to make an impact on the progressive nature of scoliosis to avoid a spinal surgery recommendation at all costs. And we can treat them earlier, so therefore they don't end up in those levels. And unfortunately, even curves that end up at a surgical level under traditional treatment options, a lot of times these modern conservative non-surgical approaches can reduce curves from surgical standards to below surgical standards if we have good compliance and good treatment options available at that point. So when you have early detection, by far it's much more successful at letting curves to treating them before they become surgical, but treating surgical level curves and reducing them is also possible. Now, is bracing necessary to treat scoliosis? Now, there's many different types of scoliosis, so there's no one treatment that works for every single patient. However, scoliosis bracing can be particularly effective on treating scoliosis, especially in younger spines and growing spines. However, corrective bracing can be used in adult patients because since we're trying to reduce the scoliosis, not just slow down progression, it definitely can be used even in an adult patient. Now, no brace alone can correct the scoliosis, but when corrective bracing is combined with other forms of therapy, rehabilitation, and exercises, it can help augment a very specific need. And what I like to say is it helps correct body molding. Now, smaller curves may not need corrective bracing and may just use therapy and rehab to help correct the spine. Every patient is unique to determine what their needs would be. Another question I get asked is that, can I die from scoliosis? Now, it's extremely unlikely that a scoliosis will be directly caused or directly related to somebody dying or a person's death. Scoliosis is a spinal condition, and it's associated with many, many complications of the body, but it's not necessarily associated with life-threatening complications. Scoliosis is progressive. It can worsen over time. It can worsen quickly during growth. It can worsen slowly over the years as an adult, but these worsening typically doesn't necessarily mean that as it gets bigger, it's going to cause death in your life. It's going to cause more complications. It can cause pain. It can cause difficulties, but typically not life-threatening issues. So this is not a common thing. The most likely serious complications, it can lead to some kind of digestive disorders and possibly some lung impairment as curves get severe, and it can lead to some disabilities like pain associated with the ability to walk and stand and be active in later stage life, but those are not really considered life-threatening conditions. Here at Scoliosis Reduction Center, we're all about informing patients about their condition and really every treatment option that's available to them. Scoliosis chiropractors can help achieve corrective treatment results by manually moving the spine into a straighter position and in making this Cobb angle actually reduce on a scoliosis x-ray. And this is done by using many different type of structural approaches. Like I mentioned, scoliosis-specific therapy, exercises, rehabilitation, and corrective bracing. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.